So one of the other things I'd really like to talk to you about, because I know this is your specialty also, is traditional Chinese medicine, how you would actually approach someone who is either pre-diabetic or actually been diagnosed with diabetes. Like as an acupuncturist, doctor of oriental medicine, what would you do for someone if they came to see you in your office?
Sure. I find acupuncture to be very helpful for prevention of diabetes and to also reduce some of the symptoms and the side effects of some diabetes medications. Um, what we do with acupuncture is we are applying pressure to certain parts of the body and we're bringing energy and prana to that area. So we're also helping to bring energy to the precious internal organs and help them to function better and bring better function to the kidneys and the adrenals and all of those internal organs. So that's another thing that I like for people to do is to add yoga into their life, because every kind of yoga that you do actually squeezes and compresses the internal organs through the movement of the torso. And that kind of, we believe that it flushes out the organs and brings in new life force into the organs and helps them to be stronger.
And I just want to bring this up because I feel like when people have that diabetes diagnosis, they're kind of like, this is the end. I'm just on medication for the rest of my life. Or some people can manage it through diet and exercise. But my feeling, I think you maybe share this too, is that we can actually heal from it. It doesn't have to be like this sentence where like we're diabetic for the rest of our lives. I feel like is there a possibility of actually healing and repairing and rejuvenating these organs?
Yes, and it can also add, like any chronic illness gives you real clarity about what your limits are and what you can or cannot do.
It's like your engine light coming on in the car.
Yes, so it gives you that real clarity of how you need to nurture yourself, how you need to value and take care of yourself. So it's like a sign and a message, okay, I'm valuable and I have got to take care of myself. So we can take chronic illness and use it to add that message to our lives of self-care. So sometimes it sounds so bad to say this, but in a way it can be a blessing in disguise. It can heal completely through lifestyle intervention, or it could be something that you manage your whole life. So it just sort of depends on the individual. It's not like the person that I've seen very skinny patients that eat a very good diet and they still have diabetes. So it's not always cut and dry the cause, or that if you live exactly perfectly that you're going to eliminate it. That's not necessarily true. But what you can do is there's a special herb that I usually give to my patients called, the name of it is Prosperous Farmer, and it's available by Kan Herb Company. You can get it on Amazon. You can just Google it. And it actually tonifies the spleen, the adrenals, and the pancreas and helps to prevent diabetes. And if you're really adventuresome, you could get the tincture, because you can actually then taste the flavor of the herbs. And Chinese herbs can be a little bitter and weird tasting, but I like that kind of thing. So you could try that for yourself. You can do the pills or the tincture.
Okay.
You could try that. And I thought maybe we could do a very easy yoga kriya that supports the health of the immune system. It's also it's a kriya where you control your breath, which is a way of helping your mind to have more control. So if you have a chronic illness, it can be very stressful just in and of itself, worrying about your illness. And sometimes there are times where your illness gets worse, sometimes it gets better. This is a kriya that's very easy, very accessible, and you hold your breath and then you kind of release your worries and your fears.
Yeah, let's do it.
Okay.
Yeah. We good here in the chairs?
Yeah, actually okay. You can do it sitting in a chair.
Okay.
And so what this kriya is you hold, it's called Kriya for Aerobic Efficiency. Okay. You could type that in Google and it'll pop up this kriya for you, Kriya for Aerobic Efficiency. And we're going to do spinal flex. I don't know if people have ever heard of that, but it's a movement where you hold onto your shins and you inhale and bring your belly and tummy forward, and then you exhale back. And it's very important to keep your head and neck level. So you're not swinging your neck like this. You're just isolating the middle of the body. So you're really squeezing and compressing those precious internal organs. And what we'll do is, in this kriya, we inhale, we suspend the breath, and then we do that movement until the point of feeling that we need to exhale. And you want to just hold the breath for a comfortable period of time, do the spinal flex, and then relax the breath.
Okay. Should our eyes be open or closed when we're doing this one?
In most Kundalini Yoga Kriyas, our eye gaze is very important. Thanks for asking. And in this Kriya, your eyes are closed. And you can, if you like, focus between the brows at the third eye.
Okay.
Okay.
Awesome.
So we'll do it together for a minute or two, and you can join us. So inhale deeply. And close the eyes, lift the spine, hold the breath, and begin to move gently in a spinal flex, flexing the middle portion of the body. And keep the eyes closed. And when you feel ready, stop moving and relax the breath. And then when you've completely exhaled, inhale completely again and suspend the breath and continue the spinal flex. And through this breath suspension and movement, you're supporting the health of the blood and the immune system. And relax. And then if you were doing this Kriya, for 3 minutes or 11 minutes, you would just relax for a few minutes when you're done and just really feel how your body's feeling in that moment, because that brings you in touch with yourself, and that in itself is curative towards the root of any illness, to be in touch with yourself and how you feel.
I feel a little lightheaded just from that little bit.
Yes, it can make you feel lightheaded. That's why you rest and relax at the end. You don't want to just jump up, because you actually could possibly pass out if you're, your body is adjusting, the equilibrium is adjusting. So that resting period afterwards, you can even lie down and cover yourself with a blanket and have a little rest and drink some water and then go on about your day.
Right. Thank you. That was awesome. That's super simple. Like I can do that at my desk at the office, or if I'm brave enough on the bus or the subway or something.
Yes. And it's so easy and relaxing.
That. Yeah, I'll definitely practice that one. Thank you so much.
You're welcome. Thank you, everyone.
Yeah, thanks for coming and talking to us, because I know this information is going to be so valuable for people. I feel like it's really, and I love it because I feel like it's so empowering that there's things we can do to help prevent it, or if we already are dealing with it, how to kind of alleviate some of the symptoms, or, I think there are ways we can even balance our blood sugar naturally. So I love getting your perspective on how we can do it all.
Thank you.
So thank you.